Health is intuitive. It's your business. Disease is what you pay for, and that's the business of medicine.
Dr. Nisha Chellam is board certified in internal medicine with 21 years of practice and teaching experience, who is also certified in functional medicine.
What kind of analysis and assessments happen as a functional medicine doctor?
For me to solve it in one visit, 2 visits, and tell you, oh, eat healthy, go exercise, is not how you solve it.
So what are the kind of steps that somebody can proactively take in a country like India, which is diabetes capital?
The biggest statistic is 57% of the folks who have diabetes do not know that they have diabetes because they don't get tested.
Dr. Nisha, you just told me about the 5 foundational pillars of health, and I would really like everyone to know.
Number 1 is how you manage stress. The second one is exercise. Then nutrition. Then comes the other big one, sleep. Obesity is a social problem.
How did you deal with your menopause? You look awesome, you look healthy, you look young and vibrant at 58.
I always tell my patients is we're like a bunch of alcoholics trying to not drink alcohol but walking in a perpetual bar. Right? Because we're constantly surrounded by unhealthy choices.
Hello everyone, welcome to another episode of Do You Mind? Before introducing this person, I would like to share that I have a lot of personal and professional stories with this person, and she's extremely special to me in my life. I faced many conditions, and one of them is an autoimmune disorder which nobody knows about until now. More than that, I'm more pleased to introduce Dr. Nisha Chellam, who is here with us today, all the way from the USA. She's here because she wants to make a difference, and she always is towards imparting the right kind of knowledge, the right kind of values and education to people. And she's done MD in internal medicine. And after that, she also did all her modules in the functional medicine from the IFM in USA. And more than anything, she has 30 years of experience in dealing with 280,000 patients. That is phenomenal. And I think someone of your stature is definitely not here in India yet. So do you mind joining us in this conversation today? So, Dr. Nisha, I have like a lot of experiences with you, and I would love to go through all of them one by one with you. But before all of that, I want to ask you one question. How do you approach medicine?
At the very first day of medical school, what I was exposed to were dead bodies. It's called the corpses, where we do dissection. To me, that was not a vision of a doctor. And I remember I walked out of medical school the very first day. Because to me, I didn't understand how we would learn from a dead body about health. But that's how, what we learned from the corpses, the dissection, was disease. As I progressed through medical school, what I realized is people come to us with diseases. We treat them. So let's say you have high blood pressure. I give you high blood pressure medicine. Does the high blood pressure actually go away? No. We're controlling diseases. So that was my version, and I didn't know any other form. So my initial version was diagnose a patient correctly and treat the patient and continue to treat the patient. What I found is I start a treatment, say for diabetes, and the same patient will die from a complication of diabetes 10 years later. So what I've done is I've not treated the patient of their disease, I've prolonged their journey to death. It's a different way of looking at it. And once I realized that it's the same people that come through the revolving door, I wanted to quit medicine. And that's when I went on a quest for a different way of thinking. So instead of treating disease, how can we get people back to health? And that's where the second half of my pivot came, which is functional medicine, where we were asking this question: what do I need to give you in order for you to feel better? What do we need to give your body for it to heal? Or what do we need to remove so that your body can heal? Those are very simple questions, but not easy to answer. Yes. So the second half of my definition of what medicine is, therapeutic partnership between a patient and a physician where we both give 100% to try and get you to the highest form of health for your age group.
That's so beautifully said, the whole thing. How does this testing happen, and what kind of depth and analysis and assessments happen as a functional medicine doctor?
Functional medicine does not mean you're never going to get medicine. It just means medications are not your only option. It is an option, but not the only option. And I think that's where people get it wrong. There's no holistic and natural way to treat every disease possible. Because like I said, by the time you have a disease, say you're 40 years old, it is a cumulative effort or cumulative accumulation of the insults that began from the day you were born. So for me to solve it in one visit, 2 visits, and tell you, oh, eat healthy, go exercise, is not how you solve it. You really need to get to, in that particular individual, what is driving the disease. Once I understand that, and what does that mean? Do I know their genetics? Do I know their blood work? Are they inflamed? Do they have a lot of stress in life? Do they sleep? Are they eating nutritious meals, or are they eating on the go? Do they hang around with people who are inspiring, or are they chronically in a negative community? Social circumstances. So all of this plays a role on how I'm going to address the issue. So it's not just blood testing.
The environmental factors like mold and toxins also, we were discussing how, they affect in a very big way.
You may have an office in the basement, may not think twice about it, but it's a moist place. There's a lot of mold in the air, and then your immune system gets triggered off and you're chronically inflamed and you don't realize that. I've had so many patients with mold who have other symptoms and never thought about mold as a problem.
What are the kind of common diseases that are prevalent today across the globe, not only in the USA, but also the ones that are very easy to prevent at an early age, and the signs of it in an early age, which is 99% preventable? This is my proactive health tip, something that probably creates a eureka moment for the people watching.
If you look at globally, it would be metabolic disorders. In fact, when you saw that during COVID, people who had metabolic disorders did not fare very well when they had the initial episode of the COVID infection. So metabolic health is a very big term. It's basically your body does not know how to utilize energy. So the energy is either stored and causing inflammation, or it's not being utilized, it's triggering off inflammation of some kind. So the metabolic disorders are probably the most common that I get to see. So in a young woman, it may manifest itself as a polycystic ovarian syndrome. In a young man, it could be just fatigue and obesity. So if I would say metabolic health is the number one disease I get to see on a day-to-day basis, closely followed by anxiety.
How do you treat anxiety or depression, or maybe the later onset of Alzheimer's and dementia that happen very early on in the gut?
I think anxiety comes from a multitude of issues, which we know. It's your upbringing. If you had anxious parents, you're most likely going to be anxious because it's a learned behavior. Number 2, if you have, gut issues and disruption, I see this with something called small intestinal bacterial overgrowth, where you have a teeming bacteria in the wrong place in the gut. They have a lot of anxiety, and when you treat that, they feel phenomenally better. And then there's a genetic component. There are certain dopamine receptors, serotonin receptors in your brain that can be affected by your genes. In other words, they don't connect well to these neurotransmitters and can also create anxiety. Some people have all of them. Studies have shown that more inflammation in the gut, there's something called LPS, lipopolysaccharides, which are parts of the bacteria. If they're present in the blood, that leads to inflammation and inflammation in the brain. And that can cause mood disorders. And as time goes by, because of their anxiety, they smoke a little marijuana or drink a little alcohol, and the anxiety actually gets worse, and they have insomnia. So you can see how these things compound. So for me to just say, I'm going to focus on your gut, is not going to solve the problem.
Yes.
Right? So I have to go back and rebuild first the mindset around the fact you should not identify with your disease.
We have treated more than 250 patients together, and I think we were pretty successful in reversing, but beyond that, if someone would want to meet the physician in person and have that personal connect, how is it even possible from testing to literally like consultation?
Today, the way I practice functional medicine, I like to have a genetic test because it tells me how you're wired. Then I'd like to have the blood test, which gives me what's happening in your body right now. So for me to understand why that is happening, if genetically, for example, let's say you're prone to high blood pressure, and then I find in the test result, you still don't have high blood pressure, but I know you have the tendency for high blood pressure from your genetics, but I see signs of inflammation or I see signs of insulin resistance, then I know you're going to develop high blood pressure because you have the potential for it. Or for instance, let's say you have gluten sensitivity, but you don't have any symptoms of gluten sensitivity. You can eat a piece of bread and feel perfectly fine. But I know down the road, you're going to have inflammation and that's going to create problems for you. So it helps me help you understand your own test results. So for instance, if I say, I want you to remove bread, you're going to fight with me. Like, why would I want to remove bread? But if I have a test that says, listen, you have the celiac genes, it's best, and this is what happens, you might be a little more inclined to say, oh, maybe I should give that a thought. So I find testing is more to engage a patient in their own treatment. So I would say we have to make do with the least amount of tests. And I've learned this in my practice in United States. Yes, we have access to a lot of testing, but they have to pay for it. So a lab bill can be $2,000. An average person cannot pay. I can't pay $2,000. I have to save for myself to go and get that kind of testing done. So I think that we have to keep that in mind. Yes, testing can be available, but it's not going to be price cheap for everybody to have it.
To see all of this, go back and think, are we actually making healthy living a complex subject in today's times? Because I know like there's a lot of testing that we can do if we want to do. There's a lot of genetic testing that we need to do if you want to do it. But at the same time, haven't our parents had it way more easier? Haven't our 3 generations ago, haven't people had it way better? And isn't this supposed to be like easy and simple? Like, why is it so complicated in today's day and age?
My mother was in her 50s. I don't think she was as strong as I'm in my late 50s. I got 2 more years to become 60, right? Mm-hmm. I don't think she was as strong as I was. Yeah. It's a very different, we have definitely progressed. That's number one. The other statement I always tell my patients is we're like a bunch of alcoholics trying to not drink alcohol, but walking in a perpetual bar, right? Because we're constantly surrounded by unhealthy choices. Like if I want to eat at 2 a.m. Vada pav, I can get it. We have changed our environment. We've made it very convenient. We have made food pleasure than nutrition. See, our parents, if I remember growing up, my grandmother, she would make breakfast. She would lock the kitchen after breakfast. There was no question of going and snacking in between. That's it. You're done. Your meal was over. And then lunch, you sat down and you only ate what was put on your plate. You can't get second helping because everybody had to be fed.
Yes.
It's a very different lifestyle. They were very limited in their consumption. There was a lot of movement. I took 2 buses to go to college. Today, I don't get out of my house and I see my patients for 8 hours sitting in a seat. So just the act of sitting causes inflammation. So you can see our lifestyle has changed. Our access to food has changed. Our chronic stress is nonstop. And to tell people, like, you got to change everything. You're in this dirty pool, but you got to drink clean water. That's what we're telling people to do. That's why it's so difficult. Get up in the morning, exercise, eat healthy, make food at home, sleep on time, hang out with friends. Everything is simpler. I mean, you can just say it, it's simply said, but to implement it, you have so many obstacles.
Yes.
Right? And we have to acknowledge that. And which is why raising an awareness that the 5 pillars of health, you need to figure out how to implement them in your life, number 1. Number 2, you don't have to be perfect. That's where the accountability, the support we all need. So creating that community of wellness is important. Health is intuitive. It's your business. Disease is what you pay for, and that's the business of medicine.
So what are the diseases like inflammation, which is unaddressed for the longest time, manifests as probably cancer and many other conditions?
Yes, this is where your genetics play a big role. So I will say, you'll hear the statement, most diseases are 85% lifestyle, 15% genetics. But the genetics puts you at a higher risk for the disease. So for example, I'll give you my example. My mother's family, she's got together with her, there are 9 siblings. Every one of them had diabetes. So when I was in my early 40s, my blood sugar was high. I had a high hemoglobin A1C. I started myself on metformin because that's what we do. That's what I did as a conventional doctor. And I assumed I'm going to be a diabetic because it runs in my family. And then I got introduced to functional medicine. I did my genetic testing and I found a heart in the diabetes gene, which means I'm protected from diabetes. So why did I get diabetes? That's the question I had to ask. And then I realized I eat the same way like my parents do. My father doesn't have diabetes. He eats like terrible. He loves sweets and never eats healthy. And my mother also has diabetes and she doesn't eat healthy. She'll say, I'll take my medications and I'll eat the sweet too, right? That's what most people in India do. I'll take a little extra insulin. So that's the philosophy we all have. But when I learned functional medicine, I realized my environment had to change. So now this was in 2011 is when I got introduced to functional medicine. And to this day, my hemoglobin A1C is 5 and my insulin is 5, right? And I know I'll never be a diabetic because again, you need to understand, you need more insight. That gave me the encouragement that I don't need to be a diabetic. It was all my lifestyle. Now, even if I had the diabetic gene, I still can prevent it because, like I said, we know what causes type 2 diabetes.
So, Dr. Nisha, you just told me about the 5 foundational pillars of health, and I would really like everyone to know the 5 foundational pillars.
So, when we do functional medicine, we look at the history, and then we look at what can we modify in a person to improve their health. There are some things we cannot modify, like your genes is what you've inherited. But the 5 pillars are modifiable. Mm-hmm. So number 1 is how you manage stress. Stress is a huge one for all of us. Some of us have the emotional ability to handle a lot of stress, right? In fact, some people are driven by stress. That's how they perform. The second one is easy, exercise. In fact, just exercise. It doesn't matter, even if you're 60 years old, you've never exercised. Now you're retired, you have the time. Within 6 months, it has been shown that their cardiovascular performance improves, their muscle mass increases. So exercise is one powerful, free intervention, free pillar of health that everybody can utilize.
So within 6 months, even if they've not exercised
yes.
for 60 years in their life.
Yeah, just show up every day at the gym, improve, make progress every day, and eventually in 6 months, you will be much better off than when you were in your 30s, right? Then nutrition. This is the hard one, right? Because everybody's view of nutrition is different. Somebody says they want to have a carnivore diet. Other people don't want to do a low carb diet or keto diet. It doesn't matter what it is. The bottom line is if you're eating enough whole foods, least amount of processing, and whatever diet you decide to follow, just do your blood test. Make sure that diet is not creating disease. Like you go on a carnivore diet, you're eating only meat 3 times a day and your cholesterol is 500, that might be a problem. Yes. And you want to stay on the carnivore diet, that's fine. Just take a statin with it. Bring down the cholesterol. So I think we need to identify what nutrition works for you. The best nutrition is the one that you will stick to. Mm-hmm. So it's not about going on a diet. It's about, can you eat whole foods in whatever form you want? That's nutrition.
And how easy it is to find out in today's day and age with so much information, my best diet.
If you eat food and you feel energized, you feel your brain works well, that's good nutrition as far as I'm concerned. Nutrition is personalized. I find nutrition is also cultural. You can't tell a South Indian to stop eating rice. It's not going to happen. But can they eat rice the right way? There's a right way to eat rice. Cook the rice, keep it in the fridge, reheat and eat it. It has more resistant starches. So this is again science. So understanding this kind of information they need to have access to on a day-to-day basis. 80% of the time, are you eating cooked food at home? Is it whole? Does it give you energy? Do you feel satisfied after you eat? Or do you feel fatigued and drained? You have to have a nap after you eat. All these are important things. Or do you have
the want to eat more?
Yeah, and you're constantly hungry. So many things play into that. So that's nutrition. Then comes the other big one, sleep, which if you don't have enough sleep, it's almost like banging your head on the wall. So what they find is if consistently you're not sleeping, people are clubbing till 1 and 2 a.m. Or sometimes I see my kids, they sit up till 6 hanging around with friends. There's a protein that gets produced which turns on genes that cause inflammation of the brain. This is from a lack of sleep. And this protein is only seen in people who've had head injury, right? So sleep is such an important one. Having a consistent bedtime, consistent wake up time. If you can wake up without an alarm, that would be most ideal. Recently, I think the New England Journal of Medicine showed, they had an article out that's obesity is a social problem. If your friends are obese, you're going to be obese. Your friends are rich, you're going to be rich, right? Who do you hang around with? If your friends are negative, you're going to be more negative. When I have patients who just cannot lose weight, they do have what is called the FTO gene, which is the fat obesity index. It's the first gene that was found that correlates to weight. And if they have inherited 2 genes, one from both parent, they have a lot of difficulty trying to lose the weight because genetically their brain doesn't have the satiation. That means when you eat, they don't feel full instantly.
Oh, that's a fight.
They say 20 minutes for your brain to feel full. These people might take 45 to 50 minutes to feel full. So if they do second and third helping, by then they're over full. There is a genetic component to it. These patients would have to exercise every day. They have to move and they have to focus on their nutrition. These are people who have obesity right from childhood. I would really encourage, there's a beautiful book called The Secret Life of Fat by Dr. Tara Sylvia. She does a very beautiful job of telling how her journey of weight loss, where she said all her friends would eat like crap and they would be thin as a rail. She eats one day off the rails, she'll gain 5 pounds. And it took her a long time to understand that she had to eat salads, she had to eat a certain way, she had to exercise for her to maintain her weight.
So any kind of lifestyle illness can be modified, right? Any kind of chronic lifestyle illness.
Your disease is a combination of your genetics plus daily habits. What you have control over are your daily habits. How consistent are you with your daily choices? Your genetics are fixed, right? You can't change, but the expression of the genes, like say, for instance, me having diabetes, my genes express the diabetes, but I was able to suppress it with changing my daily habits, right? So genes are there, but do they express themselves? That's called epigenetics, where you're looking at how the environment turns on that switch and says, okay, now you can express high blood pressure because we're eating a lot of sugar, we're not sleeping at night, we're drinking a lot of alcohol and caffeine, and now the blood pressure gene gets turned on.
So you remember like when I spoke to you in like 2019, I think, when we met, and then we went through all my reports, resulting in a lot of change in habits and lifestyle for the autoimmune condition that I had. Would you want to talk about it a little bit?
You were into fitness, you were exercising on a regular basis, but you started experiencing fatigue and you started experiencing some headaches, I remember, and you said you were having the stubborn weight that you could not get rid of. I think you had a question about your thyroid. I'm not sure if you were diagnosed with Hashimoto's before that. I couldn't remember, but we did a test. We found that you did have Hashimoto's. And so for people who don't understand or are listening for the first time, Hashimoto's, we think of it as a thyroid problem, but the thyroid is the victim of an immune system problem. So our focus in functional medicine is to address the immune system, address your gut health, which is where the immune system is housed. Make sure what you're putting into your gut feeds the good bacteria, so-called good bacteria, the ones that protect your gut lining, and then calms the immune system down. So now the immune system is not triggered by the crazy bacteria. And when it calms down, it stops attacking the thyroid, and the thyroid has some time to recover. And eventually, it can stay calm. Now, a lot of people come to us when their thyroid is completely destroyed and they want to get off their thyroid medicine. That's when it becomes difficult, right? Hashimoto's in its early stages definitely can be reversed. I've seen that happen several times, but not all the time. So this is where I think people need to understand. It depends on which stage you come. And we can try reducing your medication, but you have to be very consistent with your daily habits.
Somehow feel very bloated and or I get acne or something shows up which is a concern when I have dairy or gluten. So I'm almost always off it, like 90% of my life has been that since the time we met. Why do you think that is, one of the major factors in autoimmune conditions today to eliminate?
Gluten is a protein found in grains. It's a very difficult protein for your body to break down. So what happens is, let's say you have a genetic trait for celiac. You don't have the full gene, but you might have one of the genes. Your body doesn't break down gluten efficiently. So that's a protein. It comes to the immune system. The immune system says, I don't like this fellow. I've never seen him before. And it starts attacking because it's a foreign protein. So inflammation begins there. Casein, which is the protein in milk, is also a difficult protein to break down. And if your body doesn't break it down efficiently because your digestion is upset because you've been stressed or because you don't have the right kind of gut bacteria, because you received antibiotics, there are a multitude of reasons that your gut has shifted, then those proteins trigger off the immune system. Now, our immune system has a memory. Apparently, the T cells, which is the long-term immune system, has a memory of 100 years. We may not live to 100, but our immune system can live that long and remember it. So let's say you stopped gluten and dairy. You've been so good for 2 years, and then you go to a birthday party or a wedding and you want to have this small piece of cake. The immune system has a memory, and your reaction can be tenfold higher. And you will be inflamed for anywhere from 6 weeks to 6 months, depending on how robust your immune system reacts. So this is why it's important to understand. Now, I have patients who don't have the celiac gene. In those patients, I do bring back gluten, but not at great frequency. I'll tell them, make sure your gut is healthy. Once in a while, it's okay, but don't make it a daily habit, because we don't want the gut to have the stress of breaking down this difficult protein.
So what are the kind of steps that somebody can proactively take in a country like India, which is the diabetes capital, right?
Yeah, that's what everybody calls us, the diabetes capital. But when you go to our world data, 30% of the population of Pakistan has diabetes. India is 9% and China is 10.6% as of 2021. That's when the last data is. But we are a heavily populated nation like China and India. And so the population of people, even if it's 9%, is a large number. The biggest statistic is 57% of the folks who have diabetes do not know that they have diabetes because they don't get tested. So I think when you start looking at the India being the capital of diabetes is because of the population. Mm-hmm. Number two, we're also having an abundance of nourishment. So I'll give you myself as an example. I came to India, the last time I had visited was 2011, and then I came in 2020. Between 2011 and 2020, the changes that I saw is when I was growing up, I remember getting sweets 3 occasions: on my birthday, on Diwali, and Christmas. Other times there was no. Now you have a snack and savory bars every 2 doors, right? You can get vada pav, you can get pakoda, you can get jalebi every day of your life. There's biryani stall. Every 3rd store is a biryani stall. What has been found, it's called the twin cycle hypothesis. There are 2 organs that drive diabetes. And if you can take care of these 2 organs, you can probably reverse diabetes in this country. One is liver, the other is your pancreas. So we are chronically eating more than we need to. I mean, I had a buffet this morning. I've eaten pongal, I've eaten idli. There were like 150 items. I wanted to eat every one of them, right? Because it's available.
Choice.
I thought to myself, oh, I'm just doing 1 spoon, but I still overeat. And that's the problem. So we're eating like, let's say 2,000 calories a day. I finish already 1,500 calories for my breakfast. And then I'm still going to eat 500 and 500. So I've already exceeded my calories. So we're chronically in a caloric excess. So what happens when you eat so much? Where does all that energy go? The cells are full. They have a lot of energy. So the extra energy gets stored in the liver. How does it get stored in the liver? Yes, as glycogen, but after glycogen is full, there's only a certain amount of glycogen it can hold. It becomes fat. Fat in the liver, which is metabolic liver disease or non-alcoholic liver disease, fatty liver, is the number 1 step before you become a diabetic. Because once fat accumulates in the liver stops responding to insulin. Because what does insulin say? Insulin goes to the liver and says, hey, you normally make glucose, stop making glucose because we have enough. The liver cannot listen. It just continues to produce glucose. So now you have glucose coming from your food. Your insulin is high. Your liver is supposed to stop production of glucose. It's dumping glucose. So there's high insulin, high glucose. Now, the liver says, I have all this fat accumulation. I need to get rid of it. So it makes little small fat particles called VLDL. So these are very low density lipoproteins, and they go into the blood and they go settle in the pancreas. Now, the pancreas is not supposed to have all this fat in there. It's got all this VLDL and it's not able to produce enough insulin. So the sugar goes higher. So now you have both these organs not working, and eventually you become diabetic. But what can you do to reverse this? Get rid of the fat in the liver. How do you get rid of the fat in the liver? This is where you calorie restrict. 500 to 800 calories a day. It's almost impossible for most people, right? So you slowly change your diet to low calorie, which is lots of vegetables, fruits and vegetables, less of the heavy, deep fried stuff. Reduce even though you're eating high volume food, it's not high calorie food. Or you could do what is so-called intermittent fasting. You just don't eat for so many hours of the day. Or the other bigger thing is go dance. Aerobic exercise.
Yes.
Right? Aerobic exercise, utilize as much energy as you can possibly do, reduce the fat in the liver. Another reason in the Indian population, particularly why there is fatty liver, because I do genetics, is they don't have the capacity to extract a substance called choline from the diet. Mm-hmm. And so sometimes you need to give them choline-rich food in order to move the fat out of the liver.
Like eggs?
Eggs, fish, lentils, legumes, all of those things. So again, looking at your genetics, we in general, the Indian population, predisposed to fatty liver because we come from an ancestry where there was famine. So for the population to survive, we had an ability to store fat in the liver. We didn't store under the skin. Actually, it's better to store it under the skin because then your organs don't get damaged. Unfortunately, in the Indians, we actually damage our organs before we look fat. That's why we're the skinny, fat people, right? The tofu, thin on the outside, fat on the inside.
So is there a kind of a testing protocol that you can suggest for different age groups to be more proactive about their health?
From a functional medical standpoint, we do a complete blood count, but we interpret it differently. We do what is called the ApoB. ApoB is a protein that carries the cholesterol that is found in plaques. So the different types of low density lipoprotein cholesterol, which are found in plaques. So we look at the ApoB number. We look at
which determines a heart stroke, heart attack, or a
your
stroke.
risk for heart disease.
Okay.
Okay, it's a very complex subject there too. But in general, the higher your ApoB, the more likelihood that you will have plaque formation and therefore a risk for heart disease. So we catch that very early. We look for inflammatory markers, high sensitive C-reactive protein. If somebody is complaining, let's say, of joint problems or skin rashes, we may look at anti-nuclear antibody. We may look at the celiac testing, the IgA. We look at insulin levels, not just the blood sugar, not just A1C or fasting blood glucose, but actually the insulin level. So you could have a hemoglobin A1C of 5, but if your insulin is 15, we're catching it early. We're looking at something called ferritin. Now, ferritin is technically understood as the storage form of iron, but it's also an inflammatory marker. So if a woman has a very high ferritin, there's a likelihood that she's accumulating a lot of fat in the liver. So it's an indirect way. Then we look at the liver function tests. We're looking at something called GGT and then the AST, ALT. These are all things that will tell us and we're not looking for normal range. So the normal range is anywhere from 5 to 44. We're looking at optimal. And again, that's a buzzword in medicine. What is optimal? But when I went to medical school, which was 1980s, I've already dated myself there. But in the 1980s, I remember liver function test was 0 to 14 or 15. Now it's 5 to 45. So the population has gotten fatter in the liver. So our liver enzymes are higher. So our lab ranges have changed, but I still stick to 25, 24 for the AST, ALT. So I'm looking, and the GGT tells me how well you detox. Do you have a detox capacity in the liver? We look at the thyroid. Women in particular, there's a 300% increase in thyroid disease. It's the most common autoimmune condition. 8 out of 10 women seem to have thyroid or Hashimoto's. There's almost a 46% increased incidence of inflammatory bowel disorders, Crohn's and ulcerative colitis. Celiac has gone up. Type 1 diabetes has gone up. So there's some shift that's happening in our environment.
Is this the reason why there's so much of infertility in women as well?
Infertility is again inflammation, hormonal disruption, gut disruption. Is again all of these are complex because it's almost like everything around us is insulting us and we are not aware of it.
So how can one detox from the toxins or the environmental stress and exposure that has already caused the damage? Is there a way we can get rid of the toxicity in the body?
On a regular basis, if you can live a clean life. So if you're exercising every day, you're eating healthy, you're sleeping well, you don't stress too much, and you hang around with happy people, yes, your change happens with time. You have to first make a mind shift, right? I want to be healthy, and I'm going to be healthy. Then you create a plan. The time you lose the battle is when that stuff gets into your shopping cart and you bring it home. You can't have ice cream in the freezer and say, I'm not going to eat ice cream. You just don't buy it.
Yes.
If you crave ice cream, you need to get into your car, go to the store, buy it, eat it, and then come back. So I create an environment that allows you to be healthy. So again, yes, getting healthy is simple, like what I told you, exercise.
So do you recommend salads every day for everyone?
So I don't recommend anything for anyone. My job is to tell you, hey, this is what is happening in your body. This is how you're genetically wired. These are the changes that would be phenomenal, but I'm asking you to go to the moon. So before you go and do your PhD, you got to finish kindergarten. Start slow, small, simple steps. Change maybe breakfast and eat a food that you like. I'll give you myself an example. My most favorite dessert was tiramisu. Tiramisu is packed with inflammatory foods, right? Sugar, cream, cheese. When I learned functional medicine and I had to get off dairy, I found a place in Chicago that makes tiramisu raw vegan tiramisu. I actually spent $300 and bought a whole cake. I was so overjoyed. Anything that you love, you can find a healthier version of it if that's your.
That's very true.
And I feel that's where people miss. What they think is, oh my God, she's making me make all these changes. What am I going to eat?
Yeah.
We're in 2024. If you Google, give me a healthy way to make payasam.
Yes.
You can make it.
It's very easy.
It's very easy. And I think that's what people need to do. And they need that support. You can't do it on your own. Sometimes there are people who've done it on their own, right? And if you see, the common theme there is they made their mind up. They said, I want to lose weight. I'm going to be fit. That's the first step.
And I'll eat according to my palate, and I'll eat what I want to eat according to my taste buds. But then I will find an alternative option, which is healthier.
Yes. So we don't need to make it very complex. We don't need to feel deprived. You do need discipline.
How did you deal with your menopause and postmenopause? You look awesome. You look healthy. You look young and vibrant at 58.
Pre-menopause is 35. Start working on your health at 35. Don't wait for perimenopause, which can last 5 to 7 years. And then menopause is one day of your life, the day that you've not had a period for 1 year. And then the postmenopause is another 5 to 7 years. That's a lot, so many years of torture. It's almost like going to Vanavasam, right? Going out of, like for 14 years, you're going to be struggling.
Yeah.
Set yourself up for success by taking care of your health. The modifiable risk factors, I keep repeating like a broken record, but your nutrition, your sleep, your movement, your stress management, and your friends. If your friends are the ones who drink, who talk negatively, who are cynical, who are constantly one-upping you,
Yes.
it's not a very healthy environment. It's very difficult for you to progress. So I think those are the modifiers. Despite that, you may still have a problem because it's your brain responding to the withdrawal of the hormones. What I would encourage women in their 40s, if they see like loved ones say, hey, you're more irritable than before, or she feels more fatigue or more joint pains, I think it's important to have a conversation with your physician. Hey, are my hormones fluctuating? Do I need some kind of support? So start early before it gets really bad.
What do you think is the difference from all that we spoke between the Western approach towards functional medicine and the Indian approach towards functional medicine?
When you look at functional medicine, the origins of functional medicine, what people found is patients come to you with a specific condition. We start treating them. That particular condition gets what we say better. Somebody's standing on these 35 tacks or nails and they have pain. If you give them aspirin, is that the solution? You should ask them to get off that, right? And so that's the approach of functional medicine. Now, in India, to a large degree, there's a little bit of overlap of Ayurveda or Siddha. And so there's a little, what would I say, not necessarily a root cause. Everybody, if you talk to an Ayurvedic practitioner, they'll say that's the best approach. If you talk to a homeopathic practitioner, they'll say this is our best approach. Functional medicine is not a holistic approach. And this is something I keep telling my patients. We're not holistic or Eastern medicine. We're just a different way of thinking. We are trying to address what are those 35 tacks you're standing on? What are those? Where did they come from? How do we make sure you get off them and not get back on them? So it's a little different approach. It's not synonymous with Ayurveda or homeopathy, or for that matter, even naturopathic. For me, it has to address the science behind. I don't like to just, if you see, we've had this discussion off record about bioidentical thyroid hormones. I'm not even sure there's a science or studies that have shown that bioidentical thyroid hormones are better than the synthetic because of the variability of the thyroid you get. So I don't follow blindly everything that's being taught in functional medicine. If there's science to it, I truly absorb and practice it. So there's a little bit, you'll find a lot of physicians who practice functional medicine. Traditional MDs have a different approach to it. And I feel that's what I bring to the table.
I mean, you've seen and I've seen, and together we've had this sort of little community that we built, and we faced the big healthcare institutions and the doctors, the medical doctors,
Yes.
the fraternity, which was completely against us bringing functional medicine into this country and do more from what we're already doing. And there was so much of, I would say, quackery and a lot of conflicting thoughts from the medical fraternity. Why do you think when there is something science-backed and proven like functional medicine, a lot of doctors in the medical industry have a problem with functional medicine?
If I had two patients in the same age group, one, I was just giving medications, telling them, hey, you need to eat a little better, exercise every day, go for a walk. This patient continued to get worse, whereas all my functional medical patients got better. And I was the same doctor. So the problem is not me. The solution is not me.
Yes.
Right? The problem is the patient being engaged in their own healthcare. So functional medicine, besides it being a science, because a lot of our testing is science-backed, what is important is connecting with the patient and letting them know that their health is their responsibility. How does a patient who come and see me once a year gets refill of their medications, and when they have a stroke, they get upset with me? You didn't control my blood pressure better. But I'm seeing you once a year. I'm giving you all the 3 medications. Every time you come to my office, your blood pressure is under control. But when you go out and work on your own, you're eating, let's say, biryani or burger and fries, and you're drinking, you're not sleeping. Your blood pressure most of the time is out of control. The chances are you're going to die from the disease, right? It happens all the time. And that's the problem with conventional medicine. We are focused on the disease. We're focused on controlling, managing, suppressing manifestation of the disease. Functional medicine is looking at what can we do to make you healthy. It's a completely different approach of the same problem.
How is it different from the perspective of an insurance, for example?
Insurance is like in the West. I've been practicing in the United States from 93. In the past, when I did a test, it got done. Today, when I order a test, a clerk on the other end, the insurance company, will determine if that test is warranted or not, and they can deny it. So what the insurance companies did somewhere in between, they said, we're going to have a deductible. So you pay premiums. So for example, a family of 4 will pay a premium of, say, $1,000 a month. So that's $12,000 a month. We're paying premium. The first $6,000 comes out of your pocket. Like if you go to the doctor, it costs you $200 to see this doctor. You pay the $200. That's your deductible, right? So insurance is beginning to cover less and less of your healthcare. So what do people do? They tend to do all their tests, meet their deductible, then they want to do more tests. So I had a patient once in December. She called me. She said, Doc, can you schedule my thyroid biopsy? I said, why do you need a thyroid biopsy? Well, I met my deductible. I just want to see what's going on in my thyroid. It's almost like we forget what healthcare is, right? Where we become trained because we're paying that premium. We somehow want to benefit from it, right? So I feel like insurance should be used for something catastrophic. Like say you had a stroke despite your healthy lifestyle, mainly because you had some kind of an aneurysm and you had a stroke. That's a catastrophic and it's a huge medical bill. That's what insurance should be for. But when we start doing a mammogram, which costs just a few $100 or, something that you go to a restaurant, it's 1,000 rupees, right? You can get your mammogram done. Those things you should be able to do for yourself because it's like once a year or so. I feel like that shift should happen where you use insurance for costs or exorbitant costs that you cannot afford. I cannot afford to be in a hospital for 7 days on my own money. It'll be hundreds and thousands of dollars in the US, and here it's in lakhs. It'll be great to have an insurance to cover that. So I think you should use insurance for what it needs to be used.
What are the challenges you feel are there with the Indian diagnostic centers? And what are the scams, or what are the, findings that you've seen over the last few years?
So if one of our patients actually by mistake did the same test in 2 different labs, and I got completely 2 different results. Then you start questioning the validity of because you are making major health decisions or treatment decisions based on these. So I think that's a big issue. Then I've also noticed the pricing is so different. You can spend couple of thousands, and then some people pay 10,000. And I have no idea who is controlling all of this. So I think those are the big challenges I find when you do testing in India. Like in the US too, if you go through your insurance, the price is different than when you pay cash.
So where do you think, or what do you think is the place to go to then? I mean, for Indians to get the labs done in the right way?
So obviously this is not, I don't practice in India, but I have colleagues who do it. They kind of, they know these certain labs that they've vetted and they've done consistently. We've gotten results and they are quite consistent, and those are the labs they go. So I think it is based on your doctor.
So what's your take on 5 foods for longevity?
Number 1 is phytochemicals, and then they have antioxidants. So berries fall under that. I don't know. I mean, growing up, I never saw berries other than gooseberry. Amla is quite popular too. But in general, berries, purple, red, yellow, orange. In fact, Institute of Functional Medicine has what is called a phytochemical sheet. And I tell my patients to take 2 from every color every day if possible. Then fiber is very important because it shifts the gut microbiome, impacts your hormone health. In general, I know people talk about omega-3. Omega-3 is anti-inflammatory. You need pro-inflammation. Pro-inflammation initiates healing. Anti-inflammation controls the inflammation. So you need a good balance of both. So having omega-3 helps with vascular health, and anything that helps with vascular health will impact your health in general. And then, of course, you talk about specific foods: seeds, nuts, lentils, legumes, fish. These have been studied over and over again. Now, on the other end, if you look at somebody like Dr. Gabrielle Lyons, who's very muscle-centric and who talks a lot about protein, that's a different group of people. They talk about health and longevity based on muscle mass. So the amount of protein that we consume is important. So eating when you're hungry, stopping before you get full, and eating your fiber, your protein first before you eat the fats and carbs helps you stabilize your blood sugars, helps you reduce the degree of inflammation, and the potential for you to be healthy is there. But of course, nutrition is only one part of it. It's just one spoke in the wheel. You gotta still exercise, you gotta still sleep well, you gotta reduce your stress, and you gotta be a part of a community that values health.
That was good. So what's your take on nuts?
Seeds and nuts. So seeds are more powerful than nuts. Again, it's one of those foods that is highly regulated. It is highly processed. I have had patients who eat, like if I am myself, given a bag of cashews, I can finish the cashew in 1 hour, right? It's like candy. Everything is in the dose. Food is also in the dose. So you can have probably a handful of nuts 2 or 3 times a week. It's not something that I recommend with every meal and every day. Some people just do 2 almonds in the morning. That's fine too. I think that's a great way to begin your day, or walnuts or pecans, whatever you want. They do have they have what is called polyunsaturated fatty acids, which are good for you. I mean, they are omega-6. Like I said, pro-inflammation, anti-inflammation should be well balanced. So there's nothing wrong with seeds and nuts, just don't overdo it.
So the polyunsaturated fats and the monounsaturated fats, which are very high, you feel in nuts, is the reason why the quantity of nuts should be a handful or way lower than the quantity of the seeds.
Well, fat is calorie. Nuts are mostly fats. And you don't want to, and 1 gram of fat is 9 calories, 1 gram of carbs and proteins is 4 calories. You will gain weight if you're eating a lot of fish and nuts because they're good, right? Everything is about eating to appease your hunger, but making sure you have diversity and variety. So I cannot isolate and say, drink a lot of green tea, take a lot of nuts, eat fish, and you're going to be healthy.
So how much is too much is important. And again, like this brings me back to the question of duality that I have in my head for a very long time, which is about sports nutrition and about functional medicine, and how we were having this conversation about how living longer, healthier is about protecting your organs and not conditioning your organs to be susceptible to a lot more protein. Like when I say a lot, maybe 1 kg is equal to 2 grams of protein or more. Is that better in your like study?
The traditional requirement of protein was 0.8 milligrams per kilogram. That was a recommendation because in places like India and Africa, where we're high on carbohydrates, we were not even needing that much. And a lot of people are protein deficient. You'll see kids that are small, thin, but have a pot belly, right? So they just don't have any muscle mass in them. And that was a requirement. But we're not talking about preventing protein deficiency. We're talking about building muscle mass for longevity. When you come to that, the studies do show you need about 1.2 milligrams per kilogram, grams per kilogram. And if you are into weightlifting, doing muscular activity, you need sometime between 1.5 to 2. And if you're older, you definitely need higher because your muscle mass goes down. And as your muscle mass goes down, your health span goes down. Again, not longevity, but health span, right? Your quality of life goes down. So these studies are there, but the focus is so much on animal protein in the United States. I think the studies have repeatedly shown the plant proteins are definitely a better quality than animal protein. Animal protein comes with a lot of fat, and not everybody, I find, is able to metabolize it. And I find chasing their cholesterol, chasing the inflammatory markers. Like I have people doing butter, frying their steak in butter, and then their LDL cholesterol is well past 260, 300. There's no way I can tell them that they are going to be okay with that because the science doesn't support that, right? So I think it's very important, again, to have moderation, have a good mixture of plant and animal protein. And plant protein are not inferior, despite what everybody who promotes or supports animal protein says. Protein is protein. It doesn't matter from which source it comes. And when you combine foods well, you get all your amino acids and you do get a complete protein.
So let's say a person is not getting at least 1:1, like 1 kilogram is equal to 1 gram protein. Like I weigh 60. So if I'm not getting at least 60 grams of protein from real food, is it okay to consume plant protein?
Are you talking about protein powders?
Protein powders.
I try to minimize that. I've given that as an advice for someone who doesn't want to eat soy, doesn't want to eat lentils and legumes. Then I tell them to do the plant protein in addition to whatever other sources of protein they are willing to have. I'm not a huge fan of protein powders because I've seen sometimes when people take protein powders, they have side effects like gut issues, rashes, because it's a processed food. If you don't feel good on protein powders, try to get it from Whole Foods.
So I have a very different diet, like a dairy-free, gluten-free diet, but then I eat eggs.
Yes.
And I eat fish occasionally. So I feel as a pescatarian, I don't have same challenges as a vegetarian, especially if they're also not consuming dairy is when the problem comes.
Yes.
Because I feel these days when someone eats or drinks, let's say, a lot of peas or chickpeas, green peas, or pumpkin seed protein or pumpkin seeds, or even brown rice protein, even if it's isolate, I feel they are having some kind of gut issues, like you said, and slowly developing intolerance or a food sensitivity towards these kind of protein, like pea protein and flaxseed protein or pumpkin seed. What is your recommendation to such people?
It's the toughest. I think vegetarians are my toughest challenge. I find when people switch their diet, like say they were eating an omnivorous diet and then suddenly they decided to go completely plant-based, if they feel energized and they feel better, I let them be on it. I don't nitpick on the protein. They are exercising, they sleep better, they have energy, their cholesterol is down, their vascular health is good. I don't hang my, I don't nag them about their protein. The problem comes when someone is weak and is not doing well, no matter what diet they are on. Those are the people that you need to actually fix the gut, decrease the inflammation, look at all the pillars of health, and then get them on a diet that is sustainable for them. Now, obviously, going to make
persistent pains, right?
Yeah, chronic pain, right? You can go to McDonald's and say, I'm just going to eat the burger, not the bun. I mean, people do that. But I find that eventually it doesn't work. We want to have the diversity. I'm a big fan of omnivorous diet, which is why I don't make waves, right? I don't just say, eat 72 eggs. Don't worry about cholesterol. It's good for your brain. I'd go viral in a moment. But I tell people, like, eat what is sustainable for you and make sure you have a variety of foods. That has been the tradition most cultures anywhere in the world.
Diverse gut bacteria is the answer.
Yes.
Quality and
with
quantity.
Whole foods. And then connect with your body.
So I read your recent post about teas and weight loss.
Yes.
Is it a myth or a fact?
So, I actually some of my patients come and ask me, should I get off coffee and drink tea? So I did a little deep dive into the science. There's a lot of small studies that show that people who drink green tea actually lose weight. Yerba mate is another tea that they lose weight. There are lemon balm, but nothing like, I would say, if you can't lose weight, just drink green tea and you'll lose weight. No. It is just one of those things that helps you maintain your weight, and it doesn't, in many studies, it did control blood sugar. It did bring down weight or bring down insulin resistance. It has the catechins, so a lot of antioxidants in it. So I feel like if you love drinking herbal teas, go for it.
Like you said, yerba mate has become a very popular green tea.
I think Dr. Andrew Huberman, he invested in, I think, anything he says becomes the rage. But yes, in fact, all of the teas, all herbal teas are backed by studies. Dr. William Liu, he's done a lot. He researches this. He talks about tea showing improving health span, longevity, decreasing cancer. So I think there's a lot of science behind it, which is one of the reasons I did that post.
That's awesome. What are the most common gut issues in men and what are the most common gut issues in women?
Men, hands down, it's constipation, right? Women, it's usually irritable bowel. They feel bloated sometimes, they have diarrhea sometimes, they have constipation sometimes. So it's all over the place. And I think in men, a lot of times I find it's just they don't have like fiber. Many of them just eat grains and meat, barely touch vegetables. So, and then drinking water is another important part, right? Fiber, water, and movement. Many of them do move, but they don't have enough to feed a balanced gut microbiome. Constipation is not normal, even if it is your pattern. It should be resolved. You should look into the gut health and you should look into the diet, the stress, the vagal nerve. That's a huge part of your well-being, and try to have regular bowel movements. In fact, one of the things that my patients say is, I didn't realize that my gut was a problem, because they suddenly see a shift in their energy, their mood, their bowel movements when we solve the gut issues.
So what are the most simple hacks for these gut issues?
Chew your food. Sit down and chew your food. How many of us
Consciously.
inhale our food?
Yeah.
Like in 2 minutes, you're done with a full plate of food. Like you're just shoving it in, right? If you chew your food, that's just why salads, I'm a little hesitant to tell people to have salads, because salads have to be chewed. Otherwise, you're sending this whole pieces of raw food and then it comes out. And then you're saying, oh, I don't digest well. So you got to chew your food. That's the simplest. Number 2 is sit down and eat, rest and digest. Don't eat in a hurry. If you don't have time to eat, don't eat. That's always my advice.
So how do you shift your gut health to prevent cancer?
Oh, that's a very tough one, because we don't know, right? There are a lot of studies, but some studies show liquid sugar, if it reaches the colon, can create shift in the colonic cells. Some studies show if you don't have enough short-chain fatty acids, it puts you at a higher risk for colorectal cancers. Short-chain fatty acids come when bacteria feed off your fiber and they make the SCFA. And so you need good amounts of butyric acid. That'll reduce your risk for colorectal cancer. Sugar is another one. And then there are studies that show processed meat, which is again very controversial. Plant-based, high-fiber, diverse diet definitely reduces your risk of cancer. Exercise reduces your risk of cancer.
What does hormonal balance mean for men? And what does hormonal balance mean for women?
No, I think hormonal balance is a buzz statement, right? Everybody likes to say, oh, we got to balance your hormones. Your body balances its own hormones. What is out of balance is our life, right? So when our life is out of balance, your cortisol goes up, trying to help you the fight and flight mode. When the cortisol goes up, progesterone doesn't like cortisol. There's conflict there. When progesterone is not really great, estrogen goes out of whack, then insulin goes out of whack, and then thyroid goes out of whack. So they're all interconnected. It's always, instead of trying to balance your hormones, balance your life. And your body will get into balance.
What's the case history you take before assessing a patient's health?
If the patients do the history ahead of time, then I just need another half hour to review it before I see the patient. So we're already having a conversation. I know what the patient is coming. I understand from childhood, what are the events that have created a problem for them today? You know, the antibiotics they received, or the acne they had, or the anxiety, illnesses that they had, or abuse, whatever it might be. Everything is compressed in that history. And I already have the modifiable risk factors that I need to address. So in functional medicine, the history is probably the number one, and then the testing is number 2 in order to determine how you're going to treat a patient.
Though I know the answer to this, I'd like to hear from you. Does ghee cause heart attacks or heart issues?
So ghee per se does not, but depends, again, it's moderation, right? Ghee in Ayurveda, which very little Ayurveda that I know, I understand, is that ghee, if you put it just before you eat, a little quarter teaspoon, it helps you empty the gallbladder. And it helps with digestion, authentic ghee. What we're doing now is we're deep frying, cooking everything in ghee. And if you have the wrong genetics where you don't process saturated fats, there's a very good chance it's going to raise your cholesterol. In fact, there were some studies, I couldn't find the study, but I remember reading it years ago, a community of Punjabis who settled in UK, all the men had virtually heart attacks at 40, 45. It could be every other thing that they were doing too, but they did say the community exclusively used ghee. So that can be an issue. I would just say it's one of those things that should be done in moderation. I've been watching videos where actresses say, I put ghee in my coffee and drink it first thing in the morning, and everybody's doing that. But you're doing ghee in the morning, but you're not exercising. You don't have the fitness trainer that particular actress has where she goes to the gym for 3 hours because that's her profession.
Yes.
But you're eating ghee. You don't compare your life to someone else's.
Exactly.
You need to see, you need to get tested. So if you want to eat ghee on a daily basis, go ahead and do it, but get yourself tested. Make sure your cholesterol is okay. Your inflammatory markers are fine. And if you can get your genetics done, do that.
How does a day in Dr. Nisha's life look like?
Every day is different. But one thing I do on a regular basis, I prepare for my day ahead. I do have, fortunately, where I work, I have good control over my schedule. I can determine how many hours I want to work in a particular day. So the day before, I set my clothes up. I set my list of patients I'm going to see. I got my meals planned and my exercise routine planned. Some days, none of them work. Mm-hmm. Everything goes to hell. And some days, it goes exactly as planned. But I try to make most days work well. I would say the one thing that functional medicine taught me is you have to go with the flow, but you have to also be intentional. And you can have a perfect life. No one has. I don't know what is perfect life, but most of the times, if I end the day happy and really celebrate and have gratitude for what went right in that day, and if something went wrong, I just write it down and then I go to bed. Don't waste a moment in negative thinking. Your mind is powerful. So as long as you're not thinking negatively and you don't end the day negatively, I think that works. And I don't try to get a perfect life, but I always intend to. I never do.
That's awesome. That's really nice to know. Thank you so much for sharing it, because I really had to ask you all these questions to make a difference to the people who are watching. And I hope we work with many more people and see patients and help them reverse their conditions and whatsoever, contribute in a small way to the world.
Thank you. I really appreciated and enjoyed this conversation. And thanks once again.
Thank you so much, guys. If you really liked this episode and if you want more such phenomenal content coming your way, you should definitely like, share, and subscribe to our channel. This is what we intend to do day in and day out. We only want to give you valid, accredited, happy information which will help you forever in your life. Dr. Nisha Chellam is ready to take your consultations. I think the best thing that you can do is to actually follow her on LinkedIn, because she has a lot of good content that you can follow and will enlighten you for sure. But regardless, you can try and get in touch with us. Our email is given below this video and we will route it to her. And I hope she makes a difference to you as well.